Thank you for joining this brief training on principles of substance use prevention and health equity in action. This is the first of 3 training videos, and it's going to cover substance use prevention models. Our learning objectives for this video are to increase awareness of effective prevention interventions, provide information about the social ecological model, shared risk and protective factors framework, and resources for finding reliable prevention information. So the social ecological model is the first one we're going to cover today. And when looking at all the factors influencing a person's attitudes, beliefs, and behaviors, they can be broken down into these 5 areas. The diagram shows how the factors move from impacting the individual to further away from the individual, impacting a broader reach of the population. The first level is individual level, which includes a person's thoughts, feelings, emotions, and biology. The next level is relationships, and this can involve families, peers, neighborhoods, and significant others, partners. The third level is the institutional level, which includes schools, clubs, sports, and workplaces. The community level can include health services, parks, or neighborhoods. And the last level is the policy level, and that's the furthest level of influence from the individual, and that can involve laws, the climate, and economy. So we're just going to walk through some examples of prevention interventions for each level. The first example is that tobacco products are not sold to anyone who is under the age of 21, and that is policy. The next example is there's an annual Cinco de Mayo celebration. This is a substance-free celebration so that youth, families, and community members can enjoy the festivities. And this is community level. I'd say in school, there are many opportunities for them to get involved. Because of this, Satan feels connected to their school. And that's institutional level. At dinner, Michael and his mother talk openly about his day at school, his friends, what he thinks about, and he thinks about his peers vaping, and that is the relationship level. And lastly, Jane has many skills to cope with stressors and anxiety, and that would be the individual level. So our next model is the shared risk and protective factors model, and a risk factor is an event or condition that increases the probability of poor mental, emotional, social, or behavioral health outcomes. And a protective factor is an event or condition that increases the likelihood of positive mental, emotional, social, or behavioral health outcomes. The model is called the shared risk and protective factors model because it involves a shared set of events or conditions that impact the likelihood of a bunch of different things like substance use, delinquency, unwanted pregnancy, school dropout, violence, depression, and anxiety. And these can occur at the individual, family, institutional, or community level. And strategies that reduce youth substance use can also address additional outcomes like mental health. So, how does this work? The model works by decreasing the risk factors in multiple areas of someone's life, while also increasing the protective factors in someone's life. The model is similar to the social ecological model in that they both aim to impact multiple areas of a person's life. However, the different areas of influence do not directly line up between the models. So in the following slides, you're going to see an image at the bottom of each slide showing how the shared risk and protective factors model lines up with the social ecological model level of influence. Some of the risk factors at the individual level include early and persistent antisocial behavior, favorable attitudes toward the problem behavior, and early initiation of the problem behavior. And some predictive factors at the individual level would include good coping and problem-solving skills. At the family and peer level, risk factors could include friends who engage in the problem behavior, family management problems, family conflict, favorable parental attitudes and involvement in the problem behavior. And protective factors in the family and peer level could include relationships with pro-social peers, reliable support, monitoring, and discipline from caregivers, and clear expectations for behavioral behavior and values. At the institutional level, some risk factors could be academic failure in elementary school or lack of commitment to school. And protective factors could include school engagement, high academic standards, and school policies and practices to reduce bullying. At community level, risk factors could include availability of drugs and firearms, community laws and norms favoring drug use, firearms, and crime, and economic deprivation and social deprivation. Protective factors can include adequate socioeconomic resources, positive community norms, or connectedness to adults outside of family. Next, we're going to just go over some prevention interventions. So this is just a reflection slide, and invite you to reflect on what ideas or images come to mind when you hear prevention interventions. It's important to recognize that some people will have had previous negative experiences with prevention interventions. Some people might have positive experiences. Like all areas of science, prevention science is always adapting to new information and what's effective and what's ineffective. So some past experiences might have been not so effective, and we now know that they aren't. What community prevention strategies aim to do. Imagine you're in a room with many other people and you're all cold. You decide to get everyone a jacket to keep everyone warm in the cold room, but that might cost a lot of money. You might not be able to get jackets that fit everyone well, or you could decide to turn the heat up in the room. This would make most people feel warmer. There still might be a few people who feel cold, but then you can focus on those resources, getting those people a jacket that fits them all. This example shows that community strategies aim to improve conditions for all community members. And for those that might need that additional support, we can tailor prevention and treatment interventions to focus on meeting those individual needs. Following are examples of community prevention interventions for youth that are proven to be effective. These are healthy alternatives, enhancing connections and bonding with trusted adults, peers, and organizations, interactive skill building, promoting accurate social norms. And the following are examples of prevention interventions that are proven to be ineffective for young people. Fear arousal, one-time events, reinforcing exaggerated social norms, knowledge-based interventions, grouping at-risk youth together, moralistic appeals, and personal testimony from people in recovery. So this personal testimony from people in recovery has shown to be effective for youth who have had a previous experience with substance use, but for youth who have not had that previous experience with substance use, it is much less effective, which is why it's not recommended as a whole community prevention strategy. So this slide is just going to provide you some resources for finding prevention information at the local, state, and national level. For information about enhancing connections and bonding to trusted adults, there are several resources that at each level that provide information about having healthy conversations with youth. For information about accurate social norms at the local level, Rise Above Colorado provides social media-based information about the strengths of youth. Responsibility Grows Here provides information on retail marijuana use. Smoke Free Teen provides information and cessation resources for youth about vaping. For opportunities for skill building and healthy alternatives, Boulder County Public Health has a comprehensive list of substance use and mental health resources for parents and youth. And lastly, intervention and treatment are not necessarily community prevention strategies, but they're important parts of this comprehensive approach to youth substance use. And there are several harm reduction and treatment resources available for multiple different substances. So thank you all for coming to this training. You can join the To The Root team for the Substance Use Prevention 202 live workshop and group discussion. To schedule this workshop, please email Audrey at aschroer@bouldercounty.org. Thank you.